Today we're going to be discussing fundamentals of nursing pharm, this is our first video into our pharmacology series. In this video we will be talking about the basics. So first thing we're going to talk about is the basics of pharmacology. Next we're going to jump into pharmacokinetics. And pharmacodynamics. Pharmacodynamics. And pharmacotherapeutics. And then we're going to talk about drug interactions and adverse reactions. So interactions. And adverse reactions. There we go. And then lastly, we're going to finish off with the nursing process. Nursing process. Let's get started. Okay, so we're going to start with definition of pharm. What is pharmacology? So pharmacology is the scientific study, study of origin, nature, chemistry, effects, and uses of drugs. So study of origin, nature, chemistry, effects, and uses of drugs. So in simple terms, pharmacology is the study of drugs. So there are three big things when it comes to pharmacology. So the first one is pharmacokinetics. So the first one is pharmacokinetics. Pharmacokinetics. The second one is pharmacodynamics. And the third one is pharmacotherapeutics. So we should talk. I'm just going to change the color here. Let's talk about the first one. The first one, pharmacokinetics. Pharmacokinetics is the absorption. So absorption. I'm just going to fix this R. So the absorption, distribution, metabolism, and excretion. Of drugs. Okay, so pharmacokinetics is the absorption, how the drugs are absorbed in our body, how they're distributed, and how they're metabolized into simple chemicals or simple molecules, and then how those molecules are excreted from the body. So a good way of to think about is um, kinetics. Think about when you hear kinetics, think about car. It sounds like a car. Kinetics. So a car moves, right? So pharmacokinetics is the movement of the drug around the body. So the key word is car. Okay. So that's what you have to remember. That's for pharmacokinetics. Now for the second one, pharmacodynamics studies how drugs affect the body. So mainly the biochemical, so biochemical and physical effects of drugs in the body. Okay, so a good way to remember this is pharmacodynamics. So pharmacodynamics, you just have to remember that dynamic, right? Dynamic is something that's changing. So if something is changing, something in the body is changing. So when you take the drugs affect your body, things change in your body. So dynamics is your word. So I'm just gonna write here changing. Okay, so just remember that when you hear pharmacodynamics, it means it's changing. So so pharmacotherapeutics. What is pharmacotherapeutics? So this is kind of you probably know what it is already. It's the use of drugs to prevent and treat diseases. So use of drugs to prevent or treat diseases. There you go. So that's pharmacotherapeutics. So good way of remembering this is therapy, right? Therapy means, curing something or healing something. So the use of drugs to prevent and treat diseases. Okay, so now we're going to talk about how drugs are named and classified. So let's talk about naming and classifying drugs. All drugs have three different names. So three different names. First one is the chemical name. So chemical name. The second one is your generic name. And the third one is your trade name. So for chemical names, drugs are described by what they're made of. So chemically, what they're made of. So chemical names are specific. Oops. To their chemical makeup. The second name that drugs will have is a generic name, and generic names are names as an abbreviation of the chemical name. So they're just made simpler and easier to remember, understand, and memorize, basically. So generic names are abbreviation of chemical name. And the last type of name is the trade name. Trade names are made for marketing of the drug, and names are very easy and catchy. So mainly for marketing and easy. Now in nursing and in healthcare in general, so in nursing and healthcare, we use generic name. So always use generic name because this way everyone knows what you're talking about, which drug you're talking about, and it's also easier to avoid confusion. Because with trade names you can sometimes get them confused if you don't know the right name. But with generic name you can, even if you don't know the drug, you will kind of have an idea of what the drug is about, since it's an abbreviation of the chemical name. So we always use the generic name of the drug. Okay. So how are drugs classified? Okay. So there's two ways to classify drugs. Number one, one way to classify drugs is pharmacology. So far by pharmacologic classes. Pharmacologic. And the second type is therapeutic. Example of pharmacologic classes would be beta blockers, right? Let me just change the color here. So beta blockers. So these are classes. This is a drug class that's based on the pharmacologic function of the drug. So they are grouped together based on their function, how they're functioning. And the second type is therapeutic. So an example of a therapeutic class would be antihypertensive. Antihypertensive medications. So these are based on how these are classes that are grouped together based on how it affects the body. So therapeutic, pharmacologic, therapeutic. Just a way to remember it. Okay. So now let's talk about where drugs come from. Now, the thing you have to remember with drugs is that traditionally, so at the beginning, most drugs came from natural sources. So we're gonna write natural sources. So this included things like plants, animals, minerals, and such. So this was where majority of the drugs used to be produced from. Now, majority of the drugs are produced in labs, so laboratories, and these are often called synthetics. So these are made in labs. An example of synthetic drug would be, for example, first generation, second generation, third or fourth generation cephalosporins. So, and with this, you have to remember that the reason it's better, so I'm going to put a star beside this. The reason it's better is purity. So you make sure that drugs are pure, so there's no contaminants. So an example of drugs created in labs include the thyroid hormone that's derived from natural sources, but they're created in labs, and also insulin from bacteria that are genetically modified to produce. So I'm going to write insulin here to produce insulin for humans. Now let's talk about drug administration. How are drugs administered? So the first route of drug administration we're going to talk about is um, buccal, sublingual. So buccal. Actually, there's another C here. Buccal, sublingual, and translingual. I'm going to number it one. An example of this would be nitroglycerin. So I'm going to write it in red. Nitroglycerin. So nitroglycerin is normally given on the tongue, so it will be translingual, or sublingual as well under the tongue. And some drugs are given buccally, so that means between the cheek and the teeth. And this is done so to ensure that drugs are absorbed through the mouth's mucosa, and it prevents the drugs to be taken to the stomach, and it prevents their breakdown. So the second route is gastric. So this route is used if the patients can't take any drugs orally. So this is given straight into the GI system. Now the third one we're going to talk about is so number 3. It's the intradermal. So with intradermal, the drugs are given right under the skin. So I'm going to see if I can draw this. So if this is the skin, the needles will be, the needle is going to be inserted at probably 10 to 15 degrees right below the skin right here, and the drugs are instilled right under the skin. And this is given mainly for diagnostic purposes. The fourth one we're going to talk about is IM injections, so intramuscular. This route of administration, is given into any large muscle group or any muscle group, and this ensures rapid absorption. So rapid absorption, and also you can give large quantities of drugs. So you can give up to 3 mils. So up to 3 mils of medication, and these are normally absorbed very quickly into the bloodstream. So number 5, IV route. With IV route, this is given straight into the bloodstream. This is given as a single dose or a continuous dose. It can be drugs. It can be fluids like blood, plasma, it can be regular IV fluids, so a number of different types of fluids that can go into the IV. The sixth one we're going to talk about is our oral, which is the most common one. Now with oral administration, it's usually the safest. Why? Because it takes time for the drugs to be digested and to break down into into their active compounds. So there's some time for it, and also it releases slowly. And it's also the most convenient. So and they're least expensive too. The only part is that for oral drugs, the patients have to be conscious and be able to swallow. Our seventh one, oral or vaginal. So with rectal and vaginal medications, these can include creams, ointments, and suppositories. Normally they're given for irritation or infection treatment, and these can be absorbed systematically, just so you guys know. Now the eighth route is respiratory. So these can be any inhaler for a COPD patient that's taken by an inhaler, or or even drugs that are taken by via endotracheal tube. As an example, I'm going to write metered dose inhaler, and absorption via a respiratory route is very fast, and this can be sometimes used for emergencies. Now the next one on our list is our sub-Q drugs. So subcutaneous drugs. These drugs are given into the subcutaneous tissue, and they're absorbed very fast. And an example of this would be insulin or heparin. They are given mainly in the upper arms or into the belly area. And drugs that are given subcutaneously are normally up to 1 ml. So the 10th route is our topical drugs. So with topical drugs, it's used to deliver a drug via the skin or mucosa membrane. This route is mainly used for dermatologic, ophthalmic, otic, or nasal preparations. Okay. All right. And lastly, we don't want to forget it's the specialized infusions. So specialized infusions are given directly. So they're given directly to a specific site. So examples include epidural, intrapleural, intraperitoneal, intraosseous, and lastly intra-articular. So epidural, we know epidural is injected into the epidural space in the spine. Intrapleural is injected into the pleural cavity, and intraperitoneal is injected into the peritoneal cavity. Intraosseous is injected into the bone, so the long bone, and intra-articular is injected into a joint. So these are the specialized infusions. Okay, now this is it for this video. On the next video, we will be talking about pharmacokinetics. See you on the next one. Thank you very much. Thanks for watching.